doing at Yadaweva.
Oh my God.
Welcome back to our YouTube channel.
Yes, the children's series.
Yes. This is the, okay, we said hatutafanya hizo vitu.
Yeah.
But we have some very good stuff for you.
We do.
We're very sensitive, by the way. We want to do things that are specific, things that affect you as parents.
Yes.
New parents, old parents, but things that we usually see on a daily basis. So today we are going to do what?
We are talking about gastroenteritis.
Magonjwa ya kuhara na kutapika. Huyu asiwalete maneno mengi.
Wow.
Ni magonjwa ya kuhara na kutapika.
Yes,
Kutapika.
simple as that.
Yes. That is what we call GE. Tutaita tu, what tu tuite GE? And it goes hand in hand with dehydration.
Yeah.
Obviously. So why did we choose this topic?
Many children die from GE if it is not well managed.
Oh yeah. It's actually among the top 5
causes of
deaths for children under 5 years.
Yes.
That's the reason. Hakuna reason ingine.
Remind me, what is the reason?
No, there's no other reason. There's no other reason.
Like it is very common. It is a common cause of death to children under the age of 5.
And usually it goes unnoticed, especially dehydration.
Yes.
Dehydration. There are so many parents when they don't realize that their children are actually dehydrated, and not only parents, even medical practitioners. Obviously not nurses and doctors and CEOs. Other medical practitioners, kuna wenye they won't recognize that the child is dehydrated.
Yeah. Unfortunately. And these are they are pointers. You can just know how a child is dehydrated. Utajua tu.
So magonjwa ya kuhara na kutapika.
Welcome.
Woo! Subscribe. I'm Ann Waina. That's Ann Waina.
I'm Nastama.
Tamamugwa.
It feels odd. Why? To say the title, the nurse, the professional staff, which is odd.
I don't think you have to say it. Okay, I don't know. Yes. And we're back again. Please subscribe. Our YouTube channel is My Medical Diaries. Please subscribe, guys. Please subscribe.
And comment and like and share.
And tell us what you want us to talk about.
Honestly, guys, you're not talking. What is up?
One day, siku moja, mtatupata na 30k subscribers.
Amen.
Anyway, so dehydration. I mean, G. So basically, how will you define gastroenteritis?
Gastroenteritis.
Okay.
G. I would define it. My God. Tulisema tunatumia kizungu peke yake.
If yes,
I will define it as a bowel infection. Yeah. And because we're talking about children, in children, yeah.
Okay, anyway.
It's a bowel infection.
We learn, baby. As we teach you, we learn also. But basically, gastroenteritis is an inflammation.
Yeah.
Of the what? Of the lining of the bowel. And it can be either infectious or non-infectious.
Yeah.
That's why I didn't want to.
Oh.
It can either be infectious or non-infectious. So I didn't want to
That's why we're two of us, Bana.
It's an infection. You get it?
Oh, in particular.
Yeah, but I don't think you guys are interested in definition. I know you want to know how you can pick it and the first aid you do at home. Isn't it?
Yeah.
Yes. So, let me tell you about GE. We can start with kuhara, diarrhea.
Vomiting.
Diarrhea?
Oh, sorry, diarrhea.
And you want tell us about vomiting?
No. Sorry. Apana, keep going.
So diarrhea, there's a difference between diarrhea and loose stool. So diarrhea is more, it's defined as watery bouts of, should I use the word loose stool? But it's watery, and they should be more than
3 episodes.
More than 3 episodes in 24 hours. More than 3 episodes. But although sasa pia unapatanga 3 episodes, they are not. So yeah, watery diarrhea. Na hiyo watery ni ile watery, not loose stool.
Kama maji ya tap. Okay, like si ati inatoka na hiyo intensity but because it is the same tunaita nini, ni maji
yenye ukiona kwa diaper inakaa ni mkojo, only that it has some color.
Yeah,
so that is the area. More than 3 episodes of loose stool in 24 hours. Yes. Vomiting.
Oh my god. Vomiting. Shit.
Vomiting basically, I don't think kuna kitu, I don't think there's a specific way to describe the vomiting of GE, but usually it's after it's usually after feeds.
Or anytime the baby has fed.
Inakwanga after feeds.
They can't tolerate.
Yeah, the one that is worrying. Now I want to tell you something. I think that basically that is definition. Yeah. At least we've defined diarrhea. We've defined vomiting. We can talk about causes, isn't it?
Yep.
So diarrhea and vomiting are usually not something that is worrying, by the way. Usione mtoto wako anahara na anatapika ukuwe so worried.
Yeah.
The thing that is worrying is dehydration.
Yep. Hiyo sasa, that is serious business.
Vomiting and diarrhea will not kill your child. What will kill your child is dehydration. Kukosa maji kwa mwili. That is what will kill your child.
Yeah, because they're losing a lot of fluids when they're vomiting and they're rearing. Yeah.
So that is what will kill your child. And I think the most important thing in this topic is actually tackling diarrhea.
Yeah.
Then obviously, sasa, when you're looking at GE in itself, look at the number of times. The number of times that the child is vomiting, the number of times that the child is what?
Diarrhea. Yes.
Yeah. Basically. But before we go to dehydration, Tama can tell us a bit about causes.
Causes are many. They are bacterial, like you had defined, like we defined the term GE. We said that it could be non-infectious or infectious. So there's the bacterial, there's viral causes. Parasites.
Yeah, parasitic causes.
Yeah. Now, even some drugs or parasitic particular chemicals. Sorry.
Oh yeah.
Yeah. That have been ingested. Yep.
So those are the infectious causes mainly are bacterial, viral, and parasitic.
Yeah.
The non-infectious causes.
The
most common one. Food poisoning. Nyinyi mnaenda sherehe. Na umejua tu vizuri umeenda sherehe. Kwanza time ya December. Umepeleka mtoto sherehe, uliona alikula kuku, akakula beef, akakula watermelon, akakula pilau
na soda,
akakunywa soda, yogurt, akakula sijui nini, and then the following morning wana diarrhea, and then you bring them to hospital.
Honestly, as parents, you need to be responsible.
That is food poisoning. Yeah, that is food poisoning, and obviously you know it. Diarrhea, food poisoning, it will go away after the tummy clears. So hiyo isikushtue. Obviously you know. Even adults do this.
Si hata we say, hey, jana tulikuwa tumeenda mahali ni hiyo food inafanya nisikie vibaya tumbo.
So I don't think we are going to talk about food poisoning honestly. All you need to know is that keep hydrated. Kama unajua ulipeleka mtoto mahali akapata food poisoning, just give them a lot of water. And then obviously mtoto anapata food poisoning ni mtoto mkubwa. Not below 5.
Not below 5.
Really below 5.
Mwenye ati anaweza kula buffet properly.
Those are older children, and those ones can keep they can keep hydrated. Yeah, just give a lot of fluid
and rest.
Yes. Now about the non-infectious ones, of note, very important in the non-infectious causes is the ones that are caused by overuse of antibiotics. So there's a bacteria called C. difficile, Clostridium difficile.
My Lord.
This one affects children who are over given antibiotics, and that's why
that is a habit.
That's why we tell you don't like usizoe kupea mtoto antibiotics, especially homa unaenda over the counter, ushampea Moxil, unaenda over the una like and then by the way it's very common.
We talked about that by the way,
especially with a Moxil. A Moxil ina kosingi kaji hizo penicillin,
carbapenems
or cephalosporins, na clindamycin. Hizo ndio culprits mostly.
And this medication, you know them, munazijua hivi.
Wanazijua. So yeah, avoid overuse of antibiotics. Only use antibiotics that are prescribed.
Yes.
In the hospital or the clinic. So for the infectious causes, the most 90% of diarrhea and vomiting are caused by viral infection. And the culprit is rotavirus. Rotavirus will cause most of the infection. And that's why utapata even when you come to hospital hatukupeangi antibiotics. Please, parents, please, when your child is vomiting or when your child has loose stool, do not give antibiotics. Do not. It will make it worse.
Yeah.
It will make it worse because the infection is viral. Sawa. And we've already seen that antibiotics will cause
Is a cause. Yeah, it's a cause.
Unaendanga unapata mtu anapea mtoto Amoxil ama Flagyl because they have diarrhea. Why? For God's sake, why? Anyway, so viral infection ya diarrhea is the most common, and inakujanga na watery stool, 10 to 15, more than 10 to 15 episodes in a day. Na hiyo sasa post feed vomiting. Ya bacteria usually inakujanga sasa na utapata iko na some bloody diarrhea. Now when I say bloody diarrhea, it's bloody diarrhea. Unajua there are people who come and say that I have bloody diarrhea. Na pupu damu. And we take it so seriously. Kumbe it's in the poop you see drops of blood. That is not bloody diarrhea. That is not bloody diarrhea. So now when it's bacterial, it's usually bloody or mucoid. Sawa. But usually viral it's just watery. For parasitic infections, the diarrhea will last long. It can go even up to 2 weeks. Usually diarrhea ya viral inakuanga between 3 to 8 days inaisha. Ya bacteria by the time uone damu kwa choo, wewe unajua utakuwa ushakimbia hospitali. Ile ya parasites more than 14 days. Then diarrhea too. Yeah, basically, so those are the main causes. Note that.
Noted.
All right. So symptoms kidogo tu.
Yeah, signs and symptoms. I think we already have the cardinal signs and symptoms. You have like expounded on it. So we have talked about post-feed vomiting, and we have also talked about diarrhea. How many episodes? 3 episodes in 24 hours. Yeah.
More than.
Okay, so the other signs and symptoms, there are loss of appetite.
Yeah, obviously.
Yeah, the baby just doesn't want to eat, or the child doesn't want to eat at all. Ama ile tu kidogo because already ako irritated. And then kuna bloody poo, like your bloody stool.
Yes, it's
bacteria, the mucoid. There's abdominal pain or discomfort.
Those are the ones you have.
No, of course I have. Okay, there's also nausea and bloating.
Yes.
Yeah.
Although sasa for children under 5 wataweza explain it.
They can't. But you know, sasa a child will react or respond to the what they are feeling by being fussy, irritable.
The reason why I'm insisting on children under 5 maybe it kills children under 5.
Yeah.
For children above 5, rarely utapata na enemy.
Those are the signs and the symptoms.
All right. So I'll just expound a bit on what she said. The signs and symptoms, they depend on obviously the cause. If it's viral, if it's bacterial, as I explained. I really want to talk about signs of dehydration. Amber, were you coming to that?
Yeah, I was coming to that. We can talk about it.
Right.
We can talk about it.
All right. Dehydration.
Signs of dehydration.
Because dehydration is actually
it's like
a sign stroke symptom.
Yes, it is
of GE in itself, and that's what I want us to. I want us to.
You want me to talk about?
Yeah, you can talk about dehydration.
Okay. Kuna dry mouth and tongue. Ile when you look at the child's mouth, the mucous membrane.
Mucous membrane.
Yeah, they're dry.
Basically ni places ziko na maji huku kwa macho.
Unaona iko dry. There's sunken eyes.
Yeah.
Macho inaingia na ndani. They are not passing urine. And for babies, of course, you know because the nappies are not wet.
Yeah, they are not wet. Although sasa for those who have like watery diarrhea, unajua itakuwa a bit ngumu kusema because hiyo watery iko kwa diaper, so uta like but it's reduced urine output.
They are more sleepy than usual because you know lethargic, body ache, and also they have cold hands and feet because they're losing a lot of fluids. So definitely circulation itakuwa interrupted.
So basically, that is dehydration. So dehydration, it can be that the child can have diarrhea and vomiting with no dehydration. Utapata ako tu sawa, anahara, anatapika, but dehydration yake iko sawa. Like they are active kama kawaida, they are playing, they are eating, they are everything. That should not worry you. Just make sure they are well hydrated at home. And then now there is what we call some moderate dehydration. Watakuja na mild to moderate. Hiyo ndio sasa utaona mtoto kuna wale wana develop increase in thirst. Anataka tu kukunywa. Unapata mtoto anashika matiti ama now for those who have started eating anashinda akiitisha maji, maji hivyo.
You definitely know something is not okay somewhere.
For mild to moderate dehydration, it's not so bad. Juu mtoto bado anakuanga a bit ako alert. Alert we mean ako alert, ako active, anakunywa sana. But uta notice maybe the sunken eyes iko kidogo. Ama hata kuwa na cold peripheries obviously. Yenye inafanya tukimbie sana sasa ni severe dehydration. Because the moment you see your child anahara na anatapika, ako lethargic, hamki, sasa anikulala tu,
inactive kabisa.
Analala tu. Mkono zimekuwa baridi na mguu. Vile amesema macho imeingia ndani kama hii fontanelle. Unajua kuna wale watoto bado fontanelle haijafunga. If you see it sunken,
imeingia ndani
It's
not supposed to be sunken. Hata kama iko hapo after even like because eventually itafunga, but when kuna dehydration it is sunken more than usual. It's abnormal.
But I think what can they pick at home? What they can pick at home is lethargy actually.
Lethargy. The baby is inactive kabisa.
The reason why there's a child who died of dehydration recently in a place.
Usipin location.
In a place. Hawakupick. It was dehydration. Walikuwa tu wanaona mtoto achezi, hanyonyi vile ananyonyanga, amelala tu tangu asubuhi, like hajafeed the whole day, na saa hiyo ilikuwa kitu saa 8. So wale wa mama walikuwa around wakamwambia pana, wacha tujaribu kumpanguza, like there were so many
wako home.
Walikuwa home. So there were people came up with two opinions. But by the time they went to hospital, the child
too late.
The dehydration kills. So lethargy. And maybe I can say for children who have not yet started eating, they might not even maybe below 6 months. Maybe hawana hata hiyo diarrhea na vomiting. Ameacha tu kunyonya.
Inactivity and refusal to feed. Just come to the hospital.
wanaacha tu kunyonya, then wata develop dehydration basically.
Yeah, it is sad.
It is because it's something that is preventable.
Yeah.
Very preventable.
Now, okay, we'll get to prevention, like but they're very simple things, very simple ways of preventing dehydration and GE.
So what was that? That was what?
Signs of dehydration.
Signs and symptoms.
No, signs of dehydration. We had talked about signs and symptoms.
Those are the signs of dehydration. Yes. So basically that is it. Yeah. Severe dehydration, just come to hospital. The child is not feeding, lethargy, inactivity.
Hiyo ni admission.
Come to hospital. Wacha kusikiza huyo mama anakuambia ati yo wacha tujaribu kumpea sijui nini. Mtoto akuli anyonyi. Just come.
It's better to be safe. You better come earlier. You save the child and you save you the grief. Yeah.
Sawa. So that is it about dehydration. So the other one is what? Treatment, first aid. We can do first aid at home. First aid at home.
We said we had talked about resting and hydration. for the kids above 5 years. Lakini if it is food poisoning, it's because it will go away.
Food poisoning tu kunywa tu maji yako
na rest na
fluids.
Na fluids sio maji peke yake. Mpe fruit juice, fresh fruit juice. Mpe maji. What else is na fruits, of course, fruits, not the fruits.
If you have a blender, me I always tell people, if you have a blender, blend fruits, fresh fruit. Patia mtoto, juu wetu wanasemanga huyu atakandi maji, blend fruits, blend them,
which
and give the child.
It is way better and healthier.
Obviously, that is for children who have already started feeding.
Weaning, they've already weaned off.
More than 6 months.
And the fruit juices are healthy and they are full of nutrients. So whatever is lost is going to be replaced.
And note, please, this first aid disclaimer. These first aid tips at home are for children who are alert and active and are still feeding.
Yes, thank
if
you.
If your child is feeding,
those three main points. Yeah.
If the child is not feeding, to share establish what atu akuje hospital.
The admission.
And we didn't talk about fever. Because it usually comes with
fever. with dehydration.
No, with like GE. It comes with fever. Sometimes it comes with fever. So this first aid stuff is for children who are still feeding, who are still active. Yeah. So the other thing is hydration, as she said. Kuna kitu siku hizi mnapenda kununua inaitangwa ORS. Na watu wanakuanga nayo hata nyumbani.
They have the sachets.
Those sachets, they're not bad. They are okay. Lakini the problem is that unapatanga mtoto ametapika once, amepewa ORS. Ama amepata tu loose stool once, amepewa ORS. Like I don't know, nowadays people I think just misuse drugs.
Vibaya sana. We need to understand. We need to understand how these things work.
But ORS is good for children who have mild to moderate dehydration. Unawakorogea tu hiyo ORS wanakunywa. How do you make ORS at home?
Okay, that one sachet is
no, hiyo wachana na hiyo sachet. Hiyo sachet tunajua imekuwa kwa 1 liter. Wanajua hii ya nyumbani ya chumvi na sukari.
Hiyo ya sukari na chumvi. You use warm water alafu una measurement ya chumvi na sukari ni ka tablespoon. That's a small
teaspoon.
Teaspoon.
1 teaspoon of salt.
Yes, and
I don't know, was it 6 or 8 or 10 teaspoons of sugar. Sugar inakuwa mingi.
Teaspoon. Kale kakijiko kadogo.
Tablespoon, sorry. Tablespoon.
Okay.
In 1 liter.
1 liter, tablespoon. So tablespoon is the big spoon. Ile ya kukulia food.
Ile ya kukulia food. Yes. 1 tablespoon of salt.
10
and
8 to 10.
Acha tuiachie at 8 to 10.
But we'll give you the
tutaweka pop-up hapo. Either 8 to 10 tablespoons of sugar. You put them in 1 liter. Hiyo ni ORS nyumbani. Mtoto anakaa akikunywa hiyo. After every loose stool, anakunywa. After every loose stool, anakunywa.
And that is for the active, as you said, and the ones that are feeding.
Na kama ni vomiting pia after every vomiting episode, but utapata tu bado ana vomit hiyo ORS, kwa watoto hawapendi ORS by the way. Na
kwangi
but
tamu.
hawapendi.
It is not sweet.
So kama anakunywa fluids, it's the best.
Actually, by the way, why are we giving ORS? And okay, sawa, haina shida.
Uliza tu.
If the baby is active and they are feeding and we are giving them oral, okay, we are rehydrating them and we have encouraged resting.
Why we are giving them ORS?
Yeah,
to prevent electrolyte loss.
Okay, sawa.
Because it has a lot of electrolytes. And basically to just prevent the dehydration. Inakuanga tu ya replace electrolytes.
But that should not mean that this parent should not take the child to the hospital if anything happens, if GE has persisted.
Yeah. So basically those are the main first aid at home. Obviously kama ni fever, so unajua mambo ya fever.
Kama hujui go back to our video. We are not even talking about it.
Go back to our episode. Utaiona tu hapo ukiangalia fever. If the child has fever, those are the first aid things we should do. Yeah. Kuna first aid nyingine tunafanya nyumbani? Basically rehydration.
Rehydration too na resting. But for breastfeeding babies, the one who are less than 6 months, we were saying you breastfeed the baby like frequently.
Kama for longer periods of time.
Because sasa, but okay, kama it has persisted, you can give clear fluids, like, but I would not encourage that.
Who are not yet weaned off.
I would not encourage.
For children below 6 months, do you give ORS? We still do.
Yeah, but it should be prescribed.
Yes, it should.
So
compare to nyumbani.
Don't kuja hosi.
In fact, let me ask you a question. Wewe mama uko na mtoto wako below 6 months. Ametoa wapi ugonjwa ya kuhara na kutapika? Tuambie.
We know it.
Where did
it come from? We know the reason.
The baby is just sucking on your breast. The baby is just sucking on your breast. But I get irritated whenever kids who have not yet been weaned off come with GE. Because by then naulizanga mama, what ilitoka wapi?
Dehydration.
Where did it come from? Because rotavirus, as we said, the transmission is fecal-oral. Transmission is fecal-oral.
And we also give immunization for rotavirus.
Oh, nowadays you do.
We have been giving. Yes, we have been giving. It's according to the KP schedule. We have been giving it. Yeah.
Oh, nice.
So anakuja je na GE na anapata immunization.
Na ni matiti yako tu ananyanya. Ulienda ukachange diaper, ukakuta ukashika matiti hapo. Hygiene.
By the way, I think we'll get there. Washing your hands with soap and water.
Umeenda kwa prevention. Okay. Prevention.
Hygiene is number one priority. Yeah.
It is. Hygiene.
In capital letters.
Rotavirus transmission is fecal-oral. Nile yenye umeenda choo nini blah blah blah.
Ukakosa kuosha mikono.
And that's why by the way we see it in kids. It's very rare upate GE in adults, of course, unless they are immunocompromised. GE ya adults inakwanga ya food poisoning.
Unfortunately.
Mtoto ataenda choo, atanawa, nini, and then watoto God, I don't even feel like talking about it. Mtoto ameenda public toilet, ameguza sijui nini huko. Amekuja, amekula nini, kuguza huku chini. Watoto wa kutambaa. Kutambaa ni
crawling babies. Toddlers, because toddlers,
crawling babies like 8 months hapo. 6-8 months hapo. Ameanza kucrawl, ameshikashika huku chini, umempea kiwaru, ameshika ameweka kwa mdomo. Rotavirus, my friend, inaushika GE. So hygiene is the most important thing.
You washing your hands with soap and water.
Your kids' hands, of course, and
yours too. For the breastfeeding mothers, hata kama ni up to 2 years, before feeding the baby, after changing their nappies, you wash your hands.
Even tell them to clean their nipples.
Before breastfeeding the baby.
What was the other thing I wanted to talk about? endelea tu.
And of course hiyo ya kuosha watoto mikono because sasa kama ameanza kurusha vitu kwa mdomo, you have to be careful and responsible for that baby because sasa GE itakuwa very easy kupata.
And then unapatanga kuna house girls wenye wako tu associated na GE. Since you employed this lady, mtoto anahara tu na anatapika. I mean, seriously, enda mfunze. Before you employ your house help, please teach them about hygiene and be very specific. And obviously kama wewe hau practice pia yeye hata
practice. They will learn from you. Also washing the kids toys. Hata pia kama ni okay, tumemwin off anatumia bottles, you wash them like with soap and water, make sure they are clean. Everything the baby is using.
Hata hiyo floor, even the floor itself, watu wanaingia hapo na viatu na hapo ndio mtoto ana crawl. No please. No please, be very strict. Viatu nje. Let the place where the baby crawls hapo kitchen sitting room, let it always be clean. Watu wasikuje kukanyanga and everything.
Babies are very sensitive.
So prevention,
it's hygiene number 1. Hiyo tume-expound properly.
Immunization, Sam told you about.
Immunization.
Rotary immunization. Mnapeana gani hapa?
Rotavirus.
Rotary hiyo.
Okay. I just know rotavirus.
Na iko kwa normal schedule.
Yes, ya kepi. We even document we have given that child rotavirus. Actually, ni 10 weeks na 14 weeks.
Okay.
They get 5 drops after the polio oral. Anapata
hiyo rotavirus vaccination. Mimi nimesahau kama ilikuwa Rotary sama Rotary. So immunization iko hapo. What is that? How else do we prevent? Obviously antibiotics. Antibiotics. Please avoid giving your children antibiotics for no reason at all. Na nimempea azithromycin. Hiyo by the way, in every episode sitawahi choka kuongea about over the counter antibiotics
medication.
Na hata kwa hizi clinics mnaendanga mnapewa tu kama mtoto hajapimwa. Lakini tusiharibie watu kazi.
Lakini honestly
I used to have a clinic na nilikuwa napeana anyway.
When culprit.
Anyway, lakini tusiharibie watu nini. Lakini sometimes mwambie acha kwanza niende mtoto apimwe then I can come and get the
Workers, you should be very vigilant by the way, especially when you're dealing with kids. Kids are really very sensitive.
Flagyl ndio wanapewangwa sana.
Kwanza hata wanajuanga nitaenda nipewe kadawa Flagyl.
Ndio Flagyl ni amoeba. Imagine we use Flagyl to treat amoeba. And amoeba is not even bacteria. Imagine it's parasitical, it's only parasitical bacteria. So why are you giving Flagyl? Alafu ile siku yenye mtoto atapata amoeba tutakuja tumpe Flagyl ikose kwa
haitawaka. Atakuwa amekuwa na what do you call it?
I know the word you're looking for.
I think it is not coming.
It's okay, 3 times.
Resistance.
Yes. So I think we've talked about what? Prevention, management. Management now sasa hiyo ni ya hospitali yenyewe. You come with treat. You come with dehydration, we treat. Zinc sulfate tunapeananga. It has been shown to reduce it doesn't stop diarrhea, it just reduces the time that it takes for the diarrhea to resolve. There's something zinc does in the lining of the gut to restore the villi that help in reabsorption of water. So it reduces the amount of time that it takes for the diarrhea to resolve. It has been shown to work in developing countries.
We are in
of course we are in a developing country.
So it works.
Yes, it works.
We give it so many times.
And then wanasemanga developing countries pia kuna deficiency ya zinc. So zinc sulfate works. So upatia mtoto zinc. Hiyo hata in fact nikipata ukipea mtoto ORS na zinc hata siwezi kuuliza swali. I'll be all right.
Antibiotics is a no.
Hiyo ndio by the way tutakuta sana.
And she's ruthless.
I think that is it, isn't it? Take home message.
Take home message. What are we telling you guys?
But then niliongea fecal oral. What is fecal oral?
Maneno lakini niyo si
Niyo.
washing your hands when you get out from the loo, like that is basic,
like basically it's ingestion. Fecal oral ni transmission from the fecal matter to you ingest it. And that
we don't talk about hygiene only in these things, like we've always been told to wash our hands. May I remember since I started getting education, we've always been told to wash our hands.
By the way, ilikuwa ina try to prevent take home message.
Hygiene. My guys, hygiene, proper practice, proper hygiene for yourself, for the kids. Be safe. Alafu pia hata the water that you're using, how you're storing your food. If you're already weaned off your baby, how do you store your food? How do you cook for them? So practice proper hygiene, the way you store your food, and use clean, safe water.
Good. I think for me, my take home message is how they pick dehydration. The baby is inactive, is not feeding that lethargy. Nini, don't ignore it.
Kwa sababu unaweza kosa kuona the sunken eyes ama the dry mouth or tongue. Na pia the conjunctiva also becomes dryness. The dryness. But venye tu umesema inactivity, refusal to feed,
you can pick that easily. Then just come to hospital. Otherwise, apart from that,
we're saying goodbye.
I think so. We're saying goodbye. Cholera is bacteria. Lakini hiyo mnajua. Ama we talk about cholera sometimes.
You can do it as a topic.
We can. So we won't talk about cholera right now. Tutaongelelea hizo vingine later.
In our children's series, we have a lot more coming, guys. So you keep it here. My medical diary.
We're trying our best.
We are really trying. Yes.
Thanks for watching.
Adios.
We are millennials. Msijali, hii lazima.